Okay, let's start our final exam review. And we're going to start with chapter 1, which is anatomy and physiology of the heart. And I'm just going to put up some broad topics and then go through the topics from the chart. Sorry, from the chapter. Okay, so make sure you know the function of the heart, and that's equal to the pump for the circulatory system. Make sure you know 4 chambers. And this is 2 atrium and 2 ventricles. Make sure you know heart wall structures. Actually, maybe I'll erase. Okay, so we'll look at layers of the heart wall. And we'll start here. And this will be the endocardium. Next here, this will be the myocardium. And the next portion is going to be the pericardium, but it's divvied up into several layers itself. Okay, so we have pericardium, but that has serous, which is also broken down into 2, and then fibrous pericardium. But the serous pericardium has a visceral and a parietal layer. Okay? And it is the space between the visceral and the parietal that we call the epicardial space. Okay, and that is between here. Okay, so let's say if we draw this, and I'm going to draw out the space. And maybe we'll make this fibrous. Okay, so this will be the fibrous pericardium, and green will be the serous pericardium. Okay, and then the space will be the epicardial space. And then we would call this here is the visceral layer of the serous pericardium. And this here would be the parietal layer of the serous pericardium. Okay? Good. Make sure you know your heart valves. You have AV valves, and you have semilunar valves. The AV valves are the tricuspid and the bicuspid, also known as the mitral. And the semilunar valves are the pulmonic and the aortic valves. The AV valves function and lie between the atrium and the ventricle. They function, if I was to draw it like this, like little parachutes, and they're anchored to the bottom of the chamber. So these are the chordae tendineae, and these are the papillary muscles. And so fluid, blood is going in. And when the muscle contracts of the pericardium for atrial depolarization and then atrial contraction, these muscles pull down. And so they pull down and then create a force on these chordae tendineae that go in this direction to keep the valves closed and to pull it down. So any blood wanting to put force in this direction, okay, will not be able to push these leaves out this way. So it's pulling this way. So the force of the pull is in this direction to keep these valves closed to prevent backward blood flow. And those are for the AV valves. And then a visual for semilunar valves are kind of cusps, right? And then there has to be enough force to overcome the afterload of either the pulmonic circulation or the systemic circulation to allow blood to go, I don't know, go red again, to allow blood to go through and then not to come back against the semilunar valves. Okay. Blood flow through the heart and just overall broadly. If I'm a blood cell, I arrive via the superior and inferior vena cava. I arrive to the right atrium. I go past the tricuspid valve, enter the right ventricle, out through the pulmonic, past the pulmonic valve, into the pulmonary artery. I am at the lungs, and then I re-enter. I come back towards the heart via the pulmonary veins into the left atrium, past the bicuspid, mitral valve, into the left ventricle, and then out past the aortic valve, through the aorta. And that's blood flow. Do make sure that you know, speaking, if I go back for a minute to the valves, heart sounds. And that is lub, dub, S1, S2. These are sounds that are created by the closure of the valves. S1 is the closure of the AV valves. And S2 is the closure of the semilunar valves. Closure of the AV valves marks the onset of systole. Closure of the semilunar valves marks the onset of diastole. Okay, make sure that you know the coronary circulation. I'm going to write it in a darker color. And the main branches being the right coronary artery, the left coronary artery, which gives rise to the left anterior descending artery, and the circumflex artery. Please make sure that you understand which area of the myocardium is supplied by which of the three arteries that are listed there. So that would be table 1.1 in the textbook. The RCA is perfusing the right atrium and the right ventricle. Inferior wall of the left ventricle, posterior third of the interventricular septum, but also get an idea of the part of the conduction system that is supplied by the right coronary, which would be the SA node, as well as the AV node. Okay, in the majority of population, the right coronary artery supplies SA node and AV node. Okay. The left anterior descending, that's going to perfuse the anterior wall of the left ventricle, and then the 2/3 of the interventricular septum. It also will perfuse the right bundle branch and the left bundle branches. Okay, the circumflex perfuses the left atrium and the lateral wall of the left ventricle, as well as the posterior wall of the left ventricle. And in a smaller portion of the population, the circumflex would perfuse the SA node and the AV node. Like I said, in the majority of population, it's the right coronary artery that supplies the SA node and the AV node. And the last topic was cardiac intervention for chapter 1. And then please make sure you know the difference between the PNS and the SNS. This down regulates, this up regulates. The transmitter for this one is norepi. And the transmitter in this, oh, sorry, I totally did that backwards. Acetylcholine, sorry if I messed up anyone. And norepi. Okay. Rest and digest, and then stimulate, fight or flight.